Melatonin is a hormone that regulates our sleep-wake cycles. And melatonin supplements have been used for some time now, often for short-term treatment of insomnia. Those supplements are typically taken orally. To discuss with me his recent research on melatonin is Dr. Dennis Zetner from Herlev Hospital. Dennis, thank you so much for sharing your time today.
Yeah, you're welcome.
Dennis, melatonin is normally administered orally. Do you think there's a reason why there's been little research into alternative ways of administering melatonin?
Yes, yeah. I think there are a few reasons. One, like the largest one, I think, is that taking oral supplements is just easy. Most drugs are administered that way, and most patients are comfortable taking drugs that way. Whereas if you use melatonin or other supplemental drugs rectally or intravenously or other routes of administration, there are some hurdles that you have to go through. Intravenously, you obviously have to be around healthcare professionals. You can't do that at home. If you do it rectally, some patients might feel uncomfortable with that. If you apply it as a transdermal administration, so you apply it on the skin, that brings a lot of other hurdles that you have to get over in regards to it passing through the skin, and you don't really know how much of a dose you're receiving. And there's a difference between applying it to, for instance, your arm compared to your stomach, because the skin is different. So I think one of the main reasons is for, as you mentioned, melatonin is used as a supplement mainly, and in that regard, it's just easier to do it as an oral tablet. So that's one reason. Another reason is I believe that melatonin is a very old drug, so no medicinal companies have a patent on it, and you can't really get a patent on it, at least not for using it to induce sleep, so insomnia and jet lag, for instance. And for that reason, there isn't a lot of funding into going into doing research on other routes of administration of melatonin. So, and also the interest might not be that high. As you mentioned, the bioavailability of oral melatonin isn't that great. It's varies from study to study, but up to 15% or so. Whereas if you do other routes of administration, you can get a lot higher higher bioavailability. But with melatonin, it has near nil side effects. So if you want a higher effective dose, you can just take a larger dose, more or less. I think that's one of the reasons that some of the reasons that you haven't really seen a lot of other routes of administration of melatonin. Ease of use and the comfortability of the patients. Also, for instance, if you want to use it as a drug that you administer rectally or vaginally or other routes of administration than orally, really, you can't put it in a tablet in the same way, and then you run into difficulties with expiration dates. Like it might degrade faster if it's in a fatty solution compared to if it's in a tablet.
What role does melatonin play in your current research?
My research of melatonin hasn't really focused on the effects of melatonin on the circadian rhythm or how you might use it for jet lag. What I've been focusing on is the antioxidative effects of melatonin, where melatonin is a very strong antioxidant. And in several cell culture studies and animal trials, melatonin has been demonstrated to decrease the effect of radiation therapy in healthy cells. There's also a fairly new study in mice with tumors looking at if you administer melatonin to mice with a human breast cancer, I think it was, or colon cancer, not completely sure, but a cancer. If you administer melatonin to that mouse prior to radiation, then the radiation actually increased. The effect of the radiation on the tumor was increased. And then there are a lot of studies showing that melatonin decreases the effect of radiation on healthy cells. So the focus of my research has been both, well, the goal of my research was is to look at, can melatonin be applied in radiation oncology to diminish the degree of side effects that patients have when they are irradiated for cancer. And getting to that point, I've been looking into other routes of administration than oral, because if you, for instance, want to irradiate someone who has a vaginal or anal cancer, then you might want a very high dose of melatonin locally in the rectum or the vagina, so as to protect the healthy cells down there, where, as you said, melatonin has very, very low bioavailability, and therefore it's not that interesting to give it systemically, where you might want to administer locally to protect that area a lot better.
Where do you generally see more need for research in this area? And can you perhaps also share where the focus of your current research lies?
Well, currently I'm finishing up a couple of articles based on a study I did with the Department of Oncology at another hospital at the Rigshospitalet in Denmark, where we had women who suffer from breast cancer. They receive radiation therapy, and we, after doing the pharmacokinetic study of, among others, the transdermal administration of melatonin, we have had a double-blinded, randomized controlled study of women who receive radiation therapy for their breast cancer, and to see if we can diminish the degree of radiation dermatitis that they get as a result of the radiation therapy. Mm-hmm. Currently, we're doing analyses and are hoping to publish the articles within, or at least submit the articles, and then when they will be published is either this year or next year, hopefully. It's a slow and tedious process from writing the article to having it published, but so that's what I'm focused on currently with that area of my research.
Thank you again for your time today, and all the best of luck with your further work. Thanks.
Yeah, you're welcome.